In preparation for an incoming patient with possibility of Ebola exposure, we're showing you the donning of PPE. The first step in the donning is going to be to lay out all the materials and have a trained observer helper in the donning process. Iris will be acting as our observer helper, and Andy will be our caregiver in this process. The first step will be to inspect and then put on the PPE in order at Iris's direction.
We have everything? Okay, we'll start with the coveralls.
The patient is wearing disposable shoes that will be provided. As well, in the real thing, we have disposable scrubs at hand that you will be wearing underneath the suits. These will be located in the emergency department decon room. In preparation for the patient, an anteroom and a donning room will also be established within the ED. Part of the observation inspection process is that the suit fits correctly. It will not tear. There should be some exercising that there is a proper sizing of the suit and observation by the inspector.
If indicated at this time, if the patient is having vomiting or diarrhea, an apron could be donned at this time. This would be the apron that we would don. Now you place the hair cover on. Make sure that your hair is entirely inside and your ears are covered. Okay. Now you would apply the boot covers.
It's important that all of the steps are applied properly, because once contact with the patient has been established, there is no adjustment of the PPE that should occur.
Okay. Still move.
Notice the bows are tied in the front where access to take them off will be available.
Inner gloves are green.
It's important that the cuff of the suit extends over top of the cuff of the inner gloves.
Outer gloves are white, and so this is so that you can see if there's any obvious tears in the outer glove.
The cuff of the outer glove extends over top of the cuff of the suit.
Okay. Now your N95 mask.
The N95 mask should be applied and fitted across the face, including the nose and under the chin.
Disposable hood. Making sure that completely covers their ears and their neck. Okay, now your hood. Face shield.
The face shield may slide on the hood, and the hood moves with the head. So a piece of tape is applied to the side of the shield to keep it in place.
Okay,
At this point, the observer double checks against the patient that there's no exposed areas of skin that could be contacted, no openings in the suit or other or PPE that could lead to an exposure.
movement.
At this point, the caregiver is ready to apply care to the patient.